The abuse is continuous, and digital harassment has become part of their long-term attempt to drive me back towards self-harm. My current health and circumstances. I live with hereditary chronic pancreatitis. This is life-threatening and worsened by stress. Pulmonary fibrosis and bronchiectasis. Oxygen-dependent lung disease. Probable aspergillus colonization, because the original diagnosis of fusarium that was untreated, because they got the formal dismissal, probably a misdiagnosis, based on a mold inspection I had done immediately after the dismissal, in an attempt to try to get legal help for the patient abandonment. The mold report, the lab results from testing the surfaces in the air, both surfaces and air, showed aspergillus, which is often confused with fusarium. Okay, and then so we got chronic pancreatitis, pulmonary fibrosis, and bronchiectasis, probable aspergillus colonization. Levofloxacin caused mobility issues. That was prescribed to clear the Pseudomonas aeruginosa pneumonia 3 months before being diagnosed with the fusarium. Complex PTSD with deeply somatic symptoms and no access to trauma-informed care. Extreme medication sensitivity, because I have a history of serotonin syndrome that required emergency intervention and no access to appropriate pharmaceutical support. I am completely sober 24/7. Alcohol is contraindicated because of the pancreatitis, and cannabis causes dissociation because of the complex PTSD. I've been denied pain management, psychiatric care, and case advocacy. Where I live, and economic sabotage. I currently live with my ex-husband, John, who initially offered to be my caregiver, has since become emotionally and financially abusive, sabotages my effort to save money to leave to manufactured emergencies, interferes with my ability to sell items on eBay and maintain digital income streams. Adult Protective Services came out to my home, and they failed to intervene, instead giving him clearance to continue helping, further legitimizing the abuse. My SSDI and San Diego County Employees Retirement Association pension combined is $400 over the gross income test limit for any assistance, including housing, SNAP, Medicaid supplements. My income is at 80% federal poverty level, and sliding scale income restricted housing has 2-year-long waiting lists.